Here we go.
I will start with a disclaimer. I am a medical professional, but I am not officially trained to train people on the AED. This is just an informational video. All right, so you come into church and there is a gentleman or lady lying on the ground, looking something like this. And they are not breathing, and you can't find a pulse. Now, are they already shirtless and completely hairless? No, of course not. So we open our AED, and we have somebody go get our AED, and there is a nice pair of scissors. And we're going to use the scissors to cut off their clothing, even ladies, because we have to have bare skin here for the AED. Now, I did not put paper towels, but if this person is very sweaty or wet, you're going to want to dry them off because of electricity. Yes?
Are we allowed to ask questions?
Yes.
So on ladies, would we also cut off the bra?
Yes.
Okay.
Yes, we will.
Everything completely bare-chested?
Yes, completely bare-chested.
Got it.
Now, if it's a hairy gentleman, there is a little razor. We're going to just shave the parts over where we're going to put the pads and shave and get as much hair off as possible because it doesn't work so well with hair. And we also have a pair of gloves in here if for whatever if they're sweaty or we're going to be doing CPR afterwards, so it's always a good idea to have gloves. So this is the
adult training pads. Training. In case of emergency, remove the training cartridge and insert pads cartridge. Press the flashing blue button to choose training scenario. Scenario 1. Scenario 2. Scenario 3. Scenario 4. Scenario 5. Scenario 6. Scenario 7. Scenario 8. Begin by removing all clothing from the patient's chest.
All right,
Cut clothing if needed. When patient's chest, look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner.
All right, so this one goes up on the
Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic. Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
On the right side.
Yep,
When
right
the
up her
first pad
chest.
is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner. Place pad exactly as shown. Press pads firmly to patient's bare skin.
Now this is only if they're not breathing and you cannot find a pulse.
Make sure that the yellow plastic liner is completely removed from both pads. Place pad exactly as shown in the picture. Pads must not be touching clothing or each other.
So how many pads are there?
Two.
Press pads firmly to patient's bare skin.
Another pad there, yeah, okay.
Make sure that the yellow plastic liner is completely removed from both pads. Place pad exactly as shown in the picture. Pads must not be touching clothing or each other.
Yep, we got that.
I didn't realize it had to go.
Press pads firmly to patient's bare skin.
I just need to see where the second one was. Oh,
Begin by removing press pads firmly to patient's bare skin.
Fine. Maybe this will.
Make sure that the yellow plastic liner is completely removed from both pads. Place pad exactly as shown in the picture. Pads must not be touching. No one should touch the patient. Analyzing. Press pads firmly to patient's bare skin.
All right, fine.
It's very insistent.
No one should touch the patient. Analyzing. No one should touch the patient. Analyzing. Shock advised. Stay clear of patient. Press the flashing orange button. Shock delivered.
Okay.
Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR,
So,
press the flashing blue button. Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly.
and you're gonna go
2 inches.
at a faster rate.
Keep time
Staying
with the
alive,
beat.
staying alive. Ah, 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 staying alive. Ah.
So your hands are, see the way you got your, see,
Yeah, yeah.
like this.
One on top of the other, yep. You're
Pinch
pushing
nose,
it.
Tilt head and give 2 full breaths.
Just to give it more
Breathe.
Yeah, it gives you more.
I'm just trying to decide, which, for some reason I'm
Okay.
good, but the left hand.
So, we're gonna, in addition with this, we're also gonna be doing CPR unless they start breathing and you find a pulse.
Okay, so you had your hand this way
Yes.
rather than this way.
Yes.
Okay, that's
And
what I
you're gonna
wasn't
put your
asking.
whole body weight on top, because this gets very tiring. That's why you have to call 911 to get them in here, because you're gonna poop out after a minute or two.
Right.
Or
Do
you
you,
have
what
somebody
about
else.
mouth-to-mouth resuscitation?
Yes, well,
That's it. So
we
it's
have,
not this way, but to the side. Okay, that's what I really.
this you would put over the mouth, and then you would be able to blow in there without touching the person's mouth. Now, if it's a family member, you're not gonna care, and you're gonna tilt the head back and do CPR on them. But if it's a stranger, you might want something like this. And you're gonna watch for the chest to rise.
Right.
And it's gonna be nice and slow, 1, 2. And then you're gonna put the chin up to clear the trachea so that the air goes into the lungs rather than the stomach. So you would do 2 breaths and then 30 chest compressions. And since this is most likely to be an adult. Now children, no, it's gonna be the same ratio with children. They made it easier and just did this, the 32 breaths to 30 chest compressions. Now, if you don't feel comfortable with the breathing, you can just do chest compressions. For the most part, we have enough oxygen in our system if you see the person fall. If you come upon them and you don't know how long they're lying there, you probably need to get some air into them. But if you see them go down, you can do just chest compressions.
And the only time you use the AED is if there are no pulse and they are not breathing.
Well, that's the only time you do CPR or AED.
Okay.
If they have a pulse, but they're not breathing, you might try the
Mouth to mouth.
mouth to mouth,
And
exactly.
CPR.
And CPR. Now, if you try the mouth to mouth and you can't get anything in, it might mean they're choking, and that's when you would do, well, you can't, Heimlich maneuver. Now, if they're lying down, you cannot get them up and do the traditional Heimlich maneuver. You would be pushing up like this, and you're pushing on the diaphragm, which would blow air up, out, and pop whatever's in their throat out.
You have to press really pretty hard.
Yeah.
Yeah. It's been known to break things, but at least they live. Yes.
Jane, I heard that one time my mother was at my house and she choked on a piece of chicken, but she was still breathing.
Okay.
And I've heard that if the person is breathing, that you do not do the Heimlich
This is
maneuver.
correct.
Really?
You encourage them to cough and get it out of their throat. And if they're coughing, let them cough, maybe pound them on the back a little, but to let them cough until they get it out naturally. It's only if they can't cough and they can't get air in that you would do the Heimlich.
That would be, so it would mean that if they can't speak, That would be the same.
The traditional, this is the traditional, if somebody's
Okay.
doing that, they're telling you, I am choking. So,
Okay.
oh, that,
You're doing great.
thank you, thank you.
I didn't realize that one goes up and the other one goes sideways.
Yes.
Why is that?
I'm not exactly sure, but there is electricity going from this one to this one, and right in the direct path of that is the heart. So if the heart rhythm is all chaotic, this little jump start stops it for a second, and then, in theory, it would restart in its normal rhythm, the rhythm you've been having since you were born. So, it just sends a little shock to get things restarted. Now, if the heart is stopped, it might not do the trick. So you have to keep doing CPR until the paramedics arrive and are able to give medications and diagnose the problem
So,
of
and
when
you
the
leave
heart
the,
stopped.
while you're, if the heart isn't breathing, I mean, if the heart isn't going and
Beating.
this doesn't
This won't
work,
start it?
do you?
Yeah, well, there's times when it won't shock
Yeah,
because
so
it's
it
not
doesn't shock, so
appropriate.
you're going to CPR,
Mhm.
but do you leave those things on?
Yes, because sometimes after about a round of CPR, it'll tell you reassessing, and then you get away from it and it reassesses, and because of the CPR, it is now in a rhythm that it can shock.
Ah, okay.
So the CPR can be literally a lifesaver. It gets it
Oh, that's what they
going
say,
again.
yeah.
Yeah.
So in an event like that, it could instruct you to do it again?
Yes.
Okay.
Yeah. So,
When-
then it reassesses the rhythm several times.
Okay.
But you wait for the machine to tell you that.
Yes.
Okay.
The machine will tell
So
you.
when it's saying assessing, it's checking for the heartbeat?
Yes.
Okay.
And checking for the heart rhythm and seeing if it's in a chaotic rhythm that it needs to shock, or if it's in a rhythm that it's not appropriate to shock.
And then it'll tell you,
Yeah, they'll tell you. Yep.
Okay.
It talks to you. It tells you what's going on and what you need to do. And hopefully the paramedics will be
Right,
here
so-
pretty quick and they'll be able to
Take over.
take over for you.
Yeah.
Yes.
So it's just as important to call the paramedics
Yes.
immediately as we're pulling that thing off the wall.
Yes. If
Yeah.
you're the only person here, call 911 first.
Yeah.
And then you'll leave them on the phone and you
Yeah, exactly.
put the defibrillator on and start the CPR. Because that is more important than starting CPR immediately, unless it's a long distance away. Well, we all have cell phones nowadays.
Right.
You don't need to worry about running out of the room and then coming back.
well, it depends, I don't always have mine with me. When I'm in church, yeah, but sometimes, it might be in the other room, so I may have to, but hopefully there's somebody else there too.
Yeah. One person calls 911 and the other person puts on the defibrillator and starts CPR. And you can decide at that point who wants to do what.
Okay.
So,
You can start the CPR, I'll call them.
and do the best you
Yeah,
can.
yeah.
I mean, I don't have a mannequin. I'm not having you
Right.
practice these things. So if the best you can do with CPR is more likely to save their lives than
Not doing anything.
not doing anything.
Right.
Exactly.
Right.
Exactly.
Wow. Thank you.
You're welcome.
Yes, thank you.
Thanks, Jane.
Sure. Anybody else want to come and look and touch and